Every once in a while, there are reasons that somebody has to have their teeth extracted. So in our office, we have three main options to help replace missing teeth. Hello, Dr. Paul Connolly here again from our wonderful office at Bedford Center for Prosthodontics, Bedford, New Hampshire. I'm here in one of our treatment rooms. Just wanted to talk to you guys a little bit about the processes and the options for somebody who needs to lose all of their teeth. So in our office, we have three main options to help replace missing teeth. First, I kind of have what we call our grandmother's denture. So this is a denture, an upper denture. It sits and rests on the upper gum tissue and uses a little bit of suction to stay in place. It has very nice aesthetics. However, its biggest drawback is function. It does not chew food very well, and sometimes, unfortunately, even really well-made ones like we make here sometimes fall out when we're talking or more sneezing or laughing. So this is something that is absolutely an option, and we're gonna make a great denture when the moment is needed, but there is a few drawbacks that is not as secure as the next two options. Our secondary option starts to use implants. Implants are wonderfully helpful to help secure missing teeth. So in this situation, we have, again, a denture that does come in and out of the patient's mouth. The nice thing about that, it's easy to clean. But the nice thing is, instead of that just resting on the gum tissues, we now snap into some implant parts, and now that's quite secure. So the main advantage is there, eating efficiency is dramatically improved with this because now we have stable teeth to chew with. We also not worried about laughing really hard or sneezing or such and such, then the teeth may fall out because these are quite secured. But at the end of the day, patient snaps them out, cleans them, and then puts them in again the next day. So that's a removable solution, but with implants. Our third option is again with implants, but this time it is a fixed bridge or fixed denture. So this bridge cannot be taken out. The dentist can take that out with a special screw system, but the patient cannot take this out at all. And so the wonderful thing about that is now you're chewing anything and everything or eating anything and everything that you want to eat, biting into apples, eating corn on the cob, steaks, pizza, you name it. There's no restrictions food-wise here. The other really nice thing is, as you may have noticed, as we went from a denture to an implant denture, the size of the denture got smaller. And then when we go from an implant denture to an implant bridge, the teeth got even smaller still. So this system, what we call an all-on-X or an all-on-4 or an implant bridge, sorry for the confusion, but that's what these systems are called in different ways in different places. There is just replacing just the teeth and a little bit of the gum tissues and bone, but we do not need to cover the palate at all, and we don't have any extra coverage in any other areas. So this is, a really, really nice option. We are here at the office at Bedford Center for Prosthodontics to help answer any questions for people who might be losing their teeth. We would gladly talk more about these three different options, how we can help you get through it, what the cost structures are, whether it's extractions and if there's any sedation needs. We have the abilities to help treat you through the entire process. So please just give us a call if you have any concerns or questions about how to replace your teeth.